Hi, my name is Sarita. I am one of the dentists at Smile Clinic, and today I thought it'd be good to talk about something that maybe not a lot of people do talk about, but I know a lot of people do get affected by it, which is bad breath, and that can also be connected to bleeding gums as well. Halitosis is essentially, it's a fancy name for chronic bad breath. I don't mean when you go out and you have onions and garlic to eat and then like that evening your breath smells pretty bad. This is something that goes on long term, and it's actually something that can affect people's confidence quite a lot, and it affects more people than you think. What a lot of people don't realise is that it's often linked to oral health, and this is where we can help. So in terms of the causes of bad breath, there can be quite a few of them, but the most common ones are bad oral hygiene, especially when you don't use your floss or your TP brushes, gum disease, dry mouth, and also if you get food or plaque stuck underneath any crowns or fillings or bridges, that can also cause it. And actually a really big one is smoking. Bleed mainly because they're inflamed, and inflammation is your body's way of reacting to the buildup of plaque. And this plaque builds up in your gum margins. It's got a lot of bacteria in it, and when that comes into contact with the gums, that's what causes this inflammatory response. Essentially, it's your gum saying, help, there's something going on. Bleeding gums and bad breath really go hand in hand. When your gums are inflamed, you've got plaque there. Within the plaque, you've got bacteria. Now, as you eat, this bacteria feeds on the sugar, and that produces the gas, which is what causes the smell. Therefore, quite a lot of the time when you have inflamed gums, halitosis can be associated with that. If your gums are bleeding, yes, I definitely think it's something that's worth getting checked out. Healthy gums don't bleed, so there's definitely something going on. It could be maybe early stages of gum disease, something like gingivitis, or it could be even something more advanced like periodontitis. Either way, to catch it as early as possible is going to be super helpful. Absolutely, and that's a good thing about treating gum disease, because when we are treating gum disease, we're removing the bacteria, which is what causes breath to smell. And so quite often, quite a nice side effect of having your gums treated is the breath improves as well. So essentially, when you come to us for gum treatment, we're going to start with a full assessment. We'll do some charting, we'll take some measurements, we'll take some x-rays, possibly even some photos. Once we've then figured out exactly the extent of the gum disease, the treatment could even be something as simple as a thorough hygiene. You might need a deeper clean, so if that's the case, we can also arrange that. We also work on you being able to maintain what we've done, so we might modify your brushing technique, we might show you some more efficient ways of cleaning in between the teeth. If on the assessment we find that the issue with your gums is more severe, we actually have an on-site gum specialist and we may need to refer you to her.